hypertrophic cardiomyopathy in under 10 minutes. Okay, so let's minimize this, get it out of the way. All right, let's draw up a heart here. Okay, let's separate the chambers. Okay, remember that this is the right side and this is the left side of the heart. So if we look at the right wall of that right ventricle, then you would notice that the wall is fairly normal in size, and that's how it should look if you had a non-disease heart, right? So you have plenty of space to fill right here, blood that is. Now let's get an eraser going. Okay, let's erase this wall right here. Let's get a different color going. So what's happening in a hypertrophic cardiomyopathy? You have this enlargement of the left ventricle wall, and the muscle itself is very hypertrophic or very thickened. So if you look at the wall, you would notice that it's very thick and it's not really giving enough space for blood to fill within that ventricle, right? So let's zoom out here. Let's put that in the corner there. Okay. So in regards to a definition, let me get my black here. So definition. So what are we really looking at here in regards to a definition? Just like any cardiomyopathy, we're looking at a disease of the heart muscle wall. So we'll put here heart muscle disease, right? And something that's very important to note is that it's inherited. So you can expect to see this in the siblings and other family members, and we'll talk more about that in just a moment. And also something to make note of is that's sometimes tested as well, is that it is a disease of the functional unit of the muscle, which you may remember is a sarcomere. Sarcomere, more specifically, of the thick filaments known as the myosin filaments. Right, so any one of these could pop up as a test question, right? What is the pathological process of this disease? Okay. So let's get that out of the way there, and let's move to some of the symptoms that we would expect to see with these patients. So just like most cardiomyopathies, these patients are going to present with a very typical heart failure presentation. But in this case, these patients will present with a diastolic heart failure. And if you remember that the diastolic heart failures typically will present with an S4 on auscultation. So as far as diagnosis goes, DX, your best test to do would always be an echocardiogram. But before that, you always want to start with the cheapest test, which is probably something like an EKG or a chest x-ray. And as far as the EKG goes, what you would expect to see is a left ventricular hypertrophy, which is essentially what this disease is. And in your chest x-ray, you would probably just see an enlarged heart. That's cardiomegaly. Right, but your big one, your gold standard, is going to be your echocardiogram. And in that, you're going to see exactly what you would expect to see, a thick left ventricle. So next, let's talk about the treatment for these patients. So as far as treatment goes, really your number one, your go-to is number one is beta blockers. Any beta blocker really would be most ideal. Number two is calcium channel blockers. And really those are your two main treatments, mainstay treatments for these patients. And as a last resort or definitive treatment would be something surgical, and that would be a myomectomy. And ectomy means surgical removal, myo means muscle, so surgical removal of that excess muscle. Okay, so in regards to buzzwords, things that can help you remember Hokum or hypertrophic cardiomyopathy, one of the very first things you definitely want to remember when thinking about Hokum is how the murmur will respond to certain positions in the body. That's murmur. Okay, that's good enough. And basically we want to know what can we do to make the murmur increase in intensity and decrease in intensity, right? Real simple way of remembering how the murmur decreases is simply by thinking squatting down. The key word is in down. When you squat down, murmur goes down, right? And when you are lying down, the murmur goes down, right? So if you think about it, you squat down, murmur goes down. You lie down, the murmur goes down. As opposed to when you are standing up, then the murmur will be louder in intensity, so it will rise up. And then lastly is Valsalva. And a Valsalva is bearing down, is increasing pressure in the body. An example of that would be like bowel movements, bearing down. So if a kid dies playing sports, which right away, whenever you think of a kid dying playing sport, the first thing that should come to mind is, could this be a hypertrophic cardiomyopathy? Well, we know that the symptoms are, again, sudden cardiac death. I'm going to put CD here for time. Syncope. We know angina. And we know dyspnea. Right, so these are the associated, easy way to remember. If a kid dies playing sports, that's sad. Okay. Lastly, let's move into some vignettes. A 23-year-old male presents with syncope. On physical exam, you know a medium pitch mid-systolic murmur that decreases with squatting and increases with straining or Valsalva. Which of the following is the most likely diagnosis? Right, so we got a young male who they don't say what he was doing, but he's fainted, and upon auscultation, he has a murmur that decreases with squatting, increases with straining. Right away, we more than likely talking about a hypertrophic cardiomyopathy. Let's look at another vignette. 16-year-old male presents with complaints of syncope after playing some basketball today, and the physical exam reveals a systolic murmur along the left sternal border that increases with Valsalva. An EKG reveals a left ventricular hypertrophy. Echo shows asymmetric left ventricular hypertrophy with a hypercontractile left ventricle. Which of the following is the initial medication of choice in this patient? Right, so number one drug for a Hokum patient is always a beta blocker. And in this case, they did not give us a calcium channel blocker as an answer choice, but if they did also put a CCB in here, you still go with beta blocker. That's always the initial medication to give. Thank you.